Okay, so the custom trays now are cured, or at least the upper is, and the lower we got to do a little bit more work here. The upper one, as you saw previously, you can pry it out, but be sure to do this right after you take it out from the curing unit, because there's still a little bit of heat. If you let this cool off, you're not going to be able to pry it out unless you heat it up maybe with some hot water, because the wax now adheres to the model as well as to the custom tray, and it sticks everything together. But I took the time to pry it out right after I took it out of the curing unit, so it came out rather easily. And as we can see here, we have a nice smooth surface. Although it is matte, you're never going to get this thing smooth unless you rub it like I did with my finger. And this is what the patient's going to feel. All the surface, this is actually better that it is a little bit granular and matte, because it'll make it a little bit easier for material to stick to it. Impression material, I should say. The lower one, I'll set this one aside. The lower one, I'm not going to pry it off now. I'm going to use it on the cast and use some of the lines that I have here, like this little line back here, which indicates the center of the ridge, to incorporate, like I said before, a continuous handle here and a separated finger rest here. Or you can do it like this, or you can just use the handle. Your call, depending on the scenario that you're faced with, okay? But later on, when you see the video or the border molding video, you will see one continuous rest, as I like to call it. Okay, so for this part, I'm gonna do it in two parts. The leftover pieces that I had from the lower, I could pinch this together. It doesn't look like anything right now, but just a little bit of Vaseline, and I mean very little, not a lot. You can pinch this together firmly and create a very long handle. Again, the thickness is about 4 millimeters wide. The length is as long as I can get it. And the height is about 10 millimeters. And what I'm going to do, I'm going to adapt this here, just to show you one variation. And right about here, this is where the handle would finish, right? If I was just using a handle, I'm going to this part right here. So the area that I want to adapt to the existing base, I'm going to gently heat this at the side of the flame with my Bunsen burner. And now I want to make sure that I'm centered. Sorry. And I'm going to cut this back at a slight angle. You notice that? I'm not too concerned with the height right now. That I can adjust after the fact that I cure it with a big grinding burr or wheel. That's a lot easier trying to get it perfect now. And I'll show you that a little bit later on. But what I'm concerned mostly now with is being centered over the crest of the ridge and having the shape of the ridge, number 2, and also having adequate thickness, not too wide, not too thin, which is about 4 to 5 millimeters. I'm going to take the back of my number 7 spatula, as I did previously, heat it lightly, and burnish that in to ensure that we have a very smooth transition now between this very elongated finger rest and the rest of the tray. So it's a very smooth transition, and it makes it a lot more comfortable for the patient. And when patients are comfortable, they're going to work with you. They're going to comply to your instructions. If they're not comfortable, I think you're going to have a very difficult time trying to achieve whatever you're trying to achieve for that appointment. Comfort builds trust from your clients. When they're comfortable, they start to trust you. And when there's trust, I think that would be the ultimate compliment that I can get from a client. And I've had that before, whether we're doing shade selection for a client or whether we're doing a mold selection, and the client turns around and says, I trust you. You pick whatever you like. That's probably the ultimate compliment that a patient can give you, that they trust you. So this section right here that you see, imagine is that part of the handle if you were to do a single handle. But I didn't. I did one continuous rest. A little bit of a rough finish here. And now I'm going to use the tip of my number 7 spatula. And I'm going to burnish that in. So there's very little, if any, trimming to do, with the exception of the height. I'm not going to bother cutting that in because through experience, I've created more work for myself trying to cut that back now than simply trimming it in afterwards, which I will show you. Now, the next little portion, I will show you the difference of just having a single rest on unilaterally, so to speak, on one-sided. So I'm going to take a little bit of material. I don't have any leftover material, but certainly I can take a fresh sheet and cut some off. You don't have to cut all the way through. You can just score it a little bit and tear it off so you don't cut your fingers. And pinch it together as previously to make sure all the material becomes homogeneous, evenly put together. I'm looking for about a 10 millimeter height. I'm not concerned about the length. I'm concerned more about the height and the width, which is about 4 millimeters. Now, judging from what I just did here, I know this is going to be way too long if I'm doing a single rest. And that's okay, because I can just simply cut that off. How long should a finger rest be? Make it as long as possible. Give yourself the biggest target possible you can if you're using individual finger rest as such. So you want to create a finger rest that covers the flattest portion of the ridge. I do not go on the incline before the retromolar pad. I'm centered over the crest of the ridge, so you got to turn it over and look at it from an occlusal view or a top view. Make sure you pinch it firmly against the base. And I'm putting a lot of pressure here now, right? As I did on the other side. So if you did this all together at the same time before curing the underlining material, you would be displacing all this material here. So for that reason, I like to do it in two parts as far as the lower is concerned. I think I'm fairly close. And as a final touch, I'm going to take my number 7 spatula, heat it over my Bunsen burner, and as you can see, it creates a very smooth transition, as if this custom tray was made from one continuous piece. I'm supporting the rest with my finger as I'm putting pressure on the inside now. I'm going to cut off a little bit of the excess here. And a little bit back here at an angle, so I can have access to it and burnish it in and taper it, make it look nice, make it feel comfortable, make it functional. So just before I go back in the curing unit, and again, I'm going to cure this for another 2 minutes, I'm going to remove it from the curing unit, and I'll put it in for another 30 seconds upside down to make sure that I have thorough curing throughout the material. But before I go in, I want to make sure that I haven't moved things around. So I'm going to center the finger rests. Well, this would be a finger rest and a handle, but this would be one single finger rest. They're centered over the crest of the ridge. That way, when I place my fingers in the, and I'm using this in the patient's mouth, and I place my fingers over the finger rest, it gives me a target over the crest of the ridge, which enhances the stability of the custom tray inside the patient's mouth. And overall, I think you're going to create a more accurate impression. Okay, so I'm going to cure this and we'll come back to the trimming portion.